Welcome to This is Yoga Therapy. I'm your host, Michelle Lawrence. Join me as we venture beyond the mat into the fascinating intersections of yoga and health. Each episode brings you candid conversations with the visionary leaders and practitioners who are truly shaping this field, sharing their stories, insights, and the profound impact of yoga therapy in action. In this episode, I interviewed Dr. Carrie Demers. Dr. Carrie is a true pioneer, holding dual board certifications in both internal medicine and integrative medicine. She seamlessly blends modern science with traditional approaches like yoga, Ayurveda, nutrition, and herbal medicine. Dr. Carrie currently serves as the medical director of the Himalayan Institute's PureRejuv Wellness Center, and through the years, she's been a frequent contributor to Yoga International. Dr. Carrie, it's such an honor to meet you and have you here today.
It's such a delight to be with you, Michelle.
Well, let's just have you share a little bit more about yourself. Let's start there and really perhaps anchor it around what motivated you to move beyond conventional internal medicine and pursue such an extensive training in modalities like Ayurveda and yoga and homeopathy, and what really led you to this world.
It was mostly just, I was a believer. It's a kind of a indoctrination into modern medicine. I loved science. I wanted to help people. I loved my medical training, but I was in my residency in Chicago, a 3-year internal medicine residency. And where I started to see was that my clinic work, I knew I was going to go into primary care. So I had more clinic than my friends who were going to go into cardiology, so I started noticing that, I really have very little to offer these people. The thing about doctor training is that we all train in the hospital, and you see the incredible capacity of modern medicine to take somebody who's on death's door, had a heart attack, had a motor vehicle accident, major infection, pneumonia, and we bring them back. We help them recover and send them back out into the world. So it's really miraculous. And you become like, oh, this is so great. And if I stayed in hospital medicine, I might have just been happy there. But this outpatient world is like, all I got is a pill. That's it. That's the extent of my capacity to help you with your diabetes, depression, high blood pressure. That's all I got. And given that I was on the south side of Chicago, I saw that all the multiple factors that were contributing to people's ill health, the food deserts and the poverty and the crime and everything. This pill was nothing. This is not going to fix their life. I had a great deal of interest in humanism, in medicine, and in connecting with people and caring for people. And so I developed just a loving nature toward my patients. And so they came to see me because I listened to them and I empathized with them. And I told them, this is all I got. It might help you not have a heart attack, but, you need to do what feels right for you. And I hugged them and, that's all I could do. And then when I finished my residency, I didn't sign on to work at a regular conventional medicine practice, like an HMO. And my attendings, who thought I was pretty great because I was a good doctor, they were like, what are you going to do? They were like, my ex for dads. And I was like, I have enough dads. And I didn't know. I stepped out into the void. I worked at a immigrant clinic in Chicago for a while. And my best friend from undergrad said, come meet my homeopath. I'm like, you're a homeo? What? Like, what kind of nonsense is that? So I actually spent a day with her homeopath up in Milwaukee, not too far from Chicago. And he was a nut, but I couldn't dismiss him because he was getting people well from things that I were trained are incurable, like asthma and ulcerative colitis and whatever else. I don't remember, but I didn't understand any of it, but the people were getting better in ways that I had no understanding of. And so I was like, well, And he invited me to come work with him. And I was like, but in about 2 months, I called him back and said, is that offer still good? So I moved to Milwaukee and I got a job doing house calls to elderly people through a really great community hospital program. And that paid my bills. And then I apprenticed with this homeopath. And he had been coming to the Himalayan Institute for years. He was a meditator and a yoga practitioner. And so he sent me off to the Institute where my predecessor, Dr. Rudolph Valentine, was here and teaching about the healing force. I remember coming here and being like, oh my gosh, this is what I've been looking for all my life. Like this idea of holism, and that there's this energy, there's this healing power inside of us. That's intelligent, that's guiding our healing processes. And how do we access that? And what gets in the way of that? And it was fabulous. So, and then it was just kind of like stepping into the mist. Like, I guess I'm going to go study, yoga. And then I went to massage school. And then I went out and did a 12-day intensive in Ayurveda with David Frawley. And then I did a 2-week-long summer school in homeopathy. And I just kept doing like the next thing that kind of maybe made sense because there was no training back in the early 90s to teach this kind of stuff. And then I eventually ended up here. The director of the Himalayan Institute, Pandit Rajamani Tiganayat, had come to Milwaukee, where I was living. And through actually my massage school, I ended up meeting with him because our school was awesome and it had like yoga in it. And so I ended up meeting him and got initiated and got a mantra and meditation practice. And so he said, the Institute needs you. And I was like, by that time I'd been here a half dozen times. And I was like, sure, I'll come. So in 95, that's 30 years ago, I moved to the Institute. I'd only been doing holistic stuff for not even 3 years yet. And I started my medical directorship, on Tinderhooks. But it's been great. It's been really great. So I run a wellness center here, and I get to run weekend programs. And as you know, I do yoga as part of my integrative medicine. And I'm also a CIIYT. I did all that. I got to be grandfathered in from all my work in the field over decades.
Yeah. Such a cool story. And I love
Thanks
how
for
you got there. Yeah.
I feel like I just was led. I feel like it was just kind of like, when you step into the mist, kind of trust in your gut and there's solid ground there. It's so reaffirming that there's a knowing inside you that's guiding you. Given that I've been left brain for my whole life, that was a very right brain experience.
That's wild. I'd love to learn more about the work there, the Himalayan Institute. So you've been there for 30 years now?
Yes.
Wow. And so you're a physician and the medical director there. It's called PureRejuv Wellness Center. That's the name of the center there at Himalayan Institute, which is in Pennsylvania.
That's right. Northeast PA, near Honesdale, near Scranton, if you know the office. Yeah.
In case folks are curious as to where that is. And really, in that role, you're at the forefront of integrative health in many ways. And I'd love to hear you talk about your approach to a patient, say, who walks in with a complex chronic issue. And how do you practically blend the rigor of both internal medicine with the holistic philosophy of, say, Ayurveda or yoga or the other modalities that you bring in?
So from a philosophical view, they're not integratable. Just to put it out there, modern medical view is your biology, your physical. We need to modulate your biochemicals or do surgery. Like we're not, but from a holistic point of view, it's your consciousness and spirit and energy. And from that come your physical form. So the perspective is totally wonky, but they are integratable. That's what I do every day. And most of the patients that I see have complex medical problems. That's like why they come to me, because they're not getting where they want to be with their current medical approach. So I would say primarily, I'm definitely doing both. I do a lot of reading. I do a lot of research. I like to keep my left brain, my science mind active. I don't want to ever be seen as being woo-woo. So my holistic view of them is that they are this body, mind, spirit, emotion being, and that any of those things can be thwarting, not their spirit, but their body and energy, mind can be thwarting their own inner power to heal. So I'm holding that they have this power, and my job is to help them access it and strengthen it. I view patients through the lens of Ayurveda, through that whole, a dosha, Vata, Pitta, Kapha, Agni, the inner fire strength. I'm assessing those things and looking at how I can give them both lifestyle tools, stress management, diet changes, breathing practices, as well as herbs that don't interfere with their current medications, or homeopathy that would be balancing to their energy. And sometimes drug therapy is necessary. I'm not telling people to go off their drugs. I'm also looking for us to find new ways for them to strengthen themselves or cleanse themselves. And then over time, we might lessen a drug. But it's always under the supervision of me or their primary care doctor. We're never just stopping drugs. I mean, I'm not a fanatic. I'm really very respectful to what modern medicine can do and does for people when it comes to symptom management, people need to get out of pain, so they take pain meds. So they need to overcome a postpartum depression, so they take an SSRI. There's usefulness in drug therapy. And then we look to gradually wean from that and finding other ways to strengthen or, find balance. They are integratable. It's just, it isn't one or the other. It's really a blending. Yeah.
Mm-hmm. You mentioned using Ayurveda as a primary model to look at the individual. I'm curious because what I heard you describe too is kind of like this vision of the koshas or the biopsychosocial. Like, how much does that play into it as well? Or is it just kind of all together there?
I don't think a lot about koshas. I think I said dosha.
You did.
Yeah.
Yeah. I was curious if you thought about kosha.
Yeah. I mean, if you think about how those intersect with dosha, like how kapha could be inert and tamas has more of an inertia or heaviness, or how vata is all rajasic. So I'm thinking about those qualities. I'm probably not thinking of them as, the gunas. They're not quite so forefront of in my mind.
Mm-hmm. But you are thinking about the whole person.
Yes.
All the time.
Yes. Yeah. And qualities that are out of balance that need to be brought into balance. Yeah.
And how many people a week come to the clinic there? Well, how many patients do you see? I'm kind of curious about that and the role that the center has for the larger community, even if that's the way it works.
Yeah. So our center is both an outpatient center and a weekend retreat center. So like I might have 6 patients a week. I mean, not that many, but I also am running a weekend program from like a Wednesday to a Sunday or a Friday to a Sunday where I might see 6 more people. And because I spend so much time with people and I spend so much time considering their treatment plan, it's enough.
It's a full caseload. Yeah.
Yeah. Plus I'm also running the center. So I work with administrative things and
of course, I get that.
Meetings, all kinds of. So I would say 6 to 12 patients a week probably is all I do. And I'm only seeing usually, my weekend people could be all brand new to me, but for my outpatients, I only do 1 to 2 new people a week.
Mm-hmm. Very cool.
Yeah, keep space. But just beyond that, I have a slew of other staff here. There's a chiropractor here that she has a only local business. She's 3 days a week and she's seeing the locals. Mm-hmm. I have a slew of massage therapists, a biofeedback therapist, and 1 yoga therapist. And so they're also doing both local people that come for the weekends, for other retreats that aren't ours, might also see them. Yeah. So it's the whole blend of local folks, plus people that come in from the region or even outside. I've seen people from Idaho or Florida, wherever you'll come for the retreats, the Punch Karma, especially the ones that are longer and more transformative, people come for from a distance.
Sure. It sounds like a truly collaborative care model too. Yeah. From your perspective and in your experience, what are 1 or 2 key benefits that yoga, specifically its principles and practices, bring to a patient's treatment plan that conventional medicine alone often misses? I think this will be really interesting to our listeners.
Yes. Yeah. For given that you're yoga therapy focused. Yeah. I would say the thing that I use every day is breathing. That breathing deep and slow and even with the diaphragm is the thing that everybody needs. Like it helps your body shift from fight or flight to rest and digest. It's part of that accessing that inner capacity to heal. If I'm in fight or flight, I got very little capacity to heal. My energy's all spilling out into the world and I'm thinking and going and doing and, freaking. It's all energy out, no energy in. So if I can shift to parasympathetic, then I have restoration that's possible. And in our minds are scattered and anxious and busy when we're in that fight or flight or in that sympathetic state. And if we breathe, we can bring our minds in and feel grounded and calm and clear. And there's much more possibilities that are accessible to us when we're in that grounded, quiet space. So from every perspective, I feel like breathing is really an important tool. And most of the time, not always. I've met lots of yoga teachers that don't do breath. They teach asana. Breath to me is a key ingredient to that yoga embraces, but key for health, for helping people heal. The other, I think, more philosophical aspect of yoga that is, to me, key in healing is its capacity to be present or join with I feel like the modern medical world tends to separate us out, like away from our body, like our body's over there in the corner and we hope it works out all right. Like it's like we tend to pull away, or it's terrifying to have a bad diagnosis, whether it's cancer or autoimmune or whatever it is. And the way to heal in that state is to come into ourselves and be with that state. And there's just a lot of separation. It feels like separation. So, and we need integration. And I just feel like that yoga gives us tools to do that, to come into our bodies, into our breath, into our beings, and be more whole. I don't know if I explained that right, but that's...
You sure did. And it really resonates for me. And it feels like almost that comes first, but maybe, maybe the breath is the bridge that even makes that possible for some people. Right. And I think that's what is really unique about yoga and yoga therapy too, is that each individual who comes to the practice has their own orientation and their own window in terms of what will work, right? And what they need. But you definitely pointed to, I think, a couple key things there that make yoga unique in that way.
Just to add, this whole idea of joining with Ayurveda is really about doing experiments, like noticing what our nature is. So being present. So I always say that yoga and Ayurveda, they're sister sciences, and they both teach to pay attention, right? Yoga to our body and space and our breath and our higher selves. And Ayurveda says, notice how, a rainy day affects you. Notice how a pepperoni pizza affects you. Notice how going to bed at 1 a.m. affects you, or notice how 5 cups of coffee affects you. Like, you're present to yourself. You're noticing what serves you, what doesn't serve you, Even like noticing how your practice affects you, or noticing how an herbal therapy affects you. Like, we want to be present to all of that. So this is kind of an extension of the same thing. Like, we want to be with ourselves.
Yeah, I hadn't really thought about that, but it's so true. Well, let's talk about sort of what your experience, having done this for decades, has shown you, and maybe is unveiling some trends for what is to come too. So you've been practicing and leading for decades. Maybe you can share some of the more significant positive shifts you've observed in the Western medical community's acceptance and understanding of practices like yoga and Ayurveda.
Yeah. I am hopeful. I'm hopeful mostly because of not the medical world, but people, the patients are asking for more of a holistic approach or more other options. And because yoga has become so popular in the last few decades, when I first started in the 90s, I didn't say the word yoga because I lived in the Midwest, and it was like of the devil if you were Christian, right? So in that way, yoga's made huge strides. I mean, you can find yoga recommended on lots of websites that treat, people with arthritis or back pain or MS or autoimmune disease, or how to get pregnant when you have infertility. There's so many, like, yoga is a good tool, And even the NIH is really interested in studying yoga and studying meditation because it's got such good, good effects on the brain. So there's lots of scientific interest and affirmation of the benefits of yoga. I would say that in this country, Ayurveda is a little bit lagging. There's lots more, because of yoga, Ayurveda is now rising in popularity in the general populace, but I would say not so much in the medical world. In India, and there's a whole department of traditional medicine. Ayush is the department that studies Ayurveda, yoga, Unani, all those things. Homeopathy are all like in part of their government body. There's a thing that supports that. I love that, but not so much in this country, I don't think. But I also live in a very small place, so it's not in this small town. But maybe it is. Maybe there's more Ayurvedic, there is more Ayurvedic interest and centers that are rising. Like, there's Ayurvedic cafes, and there's people doing Ayurvedic consulting in larger cities. But I don't see the blending of those with modern medicine. I don't see those coming together very well, at least not yet. I think partly that's actually because both of them think that they're right. And they're both, there's some way that they're similar, that like we have the right way and you're wrong. So there might not be a blending of those.
I kind of know what you mean. Like, I've encountered that quite a bit lately, even on this whole topic of menopause, right? And, the movement that so many women now are taking around hormone therapies. And when I look at that from an Ayurvedic perspective or talk to an Ayurvedic practitioner around that, it's usually not in that direction. So I definitely see where that can kind of bump in more than how yoga can be such a welcome sort of complement, right? They're not competitive.
Right. It's yoga adapts to whatever, to modern life. Whereas Ayurveda is like, it has roots and there's a right way to do it. And I had the good fortune of training in Ayurveda in a very eclectic way. And in fact, my teacher called it living Ayurveda, that it's adapting Ayurveda to modern life. So I have much less rigid thinking around it. I'm like, oh, the rules are there to be broken. Like, see what's true for you. See what happens if you have fruit with your meal. Maybe, if you get, gassy, then maybe you shouldn't do it. But if you feel fine, maybe it's fine for you, as opposed to all these rules, don't never eat onion, those things. So yeah, it's a little bit of a rigid meets rigid. But I am heartened by, there have been some shifts in modern medicine. I take my board exam in internal medicine every 10 years. And every 10 years, I notice that there's changes. Like, the primary treatment for like insomnia now is sleep hygiene instead of a drug. Or the primary treatment for urinary incontinence now is pelvic floor therapy, not a drug. So there is some shift toward more holistic or integrative approaches, not herbs yet, but at least there's something.
Lifestyle is, I think, a key to that, right? I think there's just much more awareness around how lifestyle is both a contributor to detrimental health challenges, stress and lifestyle, and something that we can do in order to change that. And I think that's where yoga really has fit in. And to the extent that, Ayurveda can come from that angle, I think it probably has a better chance to feel more integrated than from a medical perspective.
That's right. That's right. Yeah. Yeah, absolutely.
Yeah. So let's talk about how you kind of build bridges a bit too. So you, through the years, have frequently contributed to Yoga International, as well as the Himalayan Institute's Wisdom Library, and I can share the links for that. And I'm just kind of curious, how do you view your role as an educator in helping practitioners and the general public bridge the gap between scientific understanding and spiritual embodiment, which is really what yoga would say?
It's a really poignant question for me right now. So I have been an educator here at the Institute, teaching people who want to know about, Ayurveda or basic health, like wellness retreats. So a lot of my audience is novice. I teach in our teacher training programs, our 300 and 200-hour training programs, a little bit. But I've been thinking lately about how, or if I could or should be reaching out toward health professionals. Like, is there something that I can offer them to make their life more satisfying? Because I find this work so wonderful. And also to have them have a greater impact on people's health and well-being. So I'm in the process of considering that. Is there something more for me to do as an educator with the modern medical world? And how would I do that? So let's see. Thank you for the question. It's right where I'm kind of spinning right now, or sitting right now, wondering kind of how to do that, or if there's a role for me in that world.
Yeah, and I hope there is. And I think that there is an interest in that, right? And I certainly see that in the way that healthcare providers are signing up to do yoga therapy trainings, right? And they have for many years. It's not new. Right. And so at least at Inner Peace Yoga Therapy, I would say there's a pretty solid percentage of our students that come in either with mental health degrees, or maybe they're nurses or PAs or MDs. And I don't think that we at Inner Peace are alone in that. So there's that interest. And then this year, I've got a group of students who are doing a 200-hour with me, and they're they're not mental health, but they're healthcare professionals, some of them mental health. And so that program was really designed to address that population specifically with a 200-hour program that isn't really about teaching studio-based classes per se, right? So I think your personal query is one that is needed out there. And with your experience and the role that you have today, I think you could offer a lot of value to folks in that space. Yeah.
Thank you. Thanks for the information. And we'll see what happens.
Yeah. Yeah. So I'm just kind of curious if there's anything else you'd like to share with our listeners about the PureRejuv Wellness Center, your work, any upcoming projects.
Thank you for that. That's nice. So just so everybody out there knows, the PureRejuv Wellness Center is the health division of the Himalayan Institute. We run weekend wellness programs almost every weekend. If you ever want to, if you're near Northeast PA, we're about 3 hours from everything. Well, not everything, not where you are,
but New York or Philadelphia.
Yeah, right. New York, Philly, New Haven, Albany. I don't know. We're 5 hours from Pittsburgh, maybe another hour or two from Akron, Ohio folks. We're probably 5 hours from Virginia. It's just, we're pretty close. And if it appeals to you to come for a weekend retreat, please do. Or if you really want a more Ayurvedic approach to a significant health problem, I would say come to a long retreat. We run Panchakarma and what I call Panchakinda, which is pure rejuvenation. It's the same treatments, but not the Khichdi fast. So just, Panchakarma is a Ayurvedic cleansing, restorative process. And usually when you go to India, it's a month long, and we shrink ours to 4 days. So it's what people can manage time and money wise. So and still it's impactful. So I welcome you all to consider that if that's in your whatever your interest to do so. We also have online programs. I'm about to teach an online program called the Somatic Psychology of Yoga with my colleague Sandra Anderson. We've done this a few years in a row. It's my favorite program to teach. It's about really witnessing ourselves, back to that being present to ourselves in yoga. It's much more the mentally, observing our minds, the nature of our minds, and how yoga gives us practices to work with our mind through yamas and yamas, through Yoga Sutra 133, and doesn't matter. But it's really fun. It's really fun to witness our egos, our asmita, and get a handle on, or at least begin to be open to how that can change. Even though we think of ourselves as being a concrete personality, we call it our factory settings are a little bit faulty, that they're set to survival as opposed to joy. So it's fun to use yoga practices to work with our mind.
Mm-hmm.
Yeah, it's really
those sound like really great opportunities. I'm originally from New Jersey, so orienting me to 3 hours near many places is familiar. Mm-hmm. So great to know that you're there and have so much to offer. And thanks for all that you do.
Yeah, it's fun.
And so my last question is pretty much the same for each guest that I've had on the podcast. And it's really just a window into your own personal practice, because we know that that's just so important in order to do the work that we do in the world and to carry the traditions forward and to even have a sense of how these practices work, right, with others, is to first do your own practice. So I'm curious what your personal practice looks like.
I love that you really push your students in this direction, that you have to have a practice to do good therapy with people. Well, over 30 some years, it's changed a lot here and there. I've fallen off the wagon and not done practice for months at a time in my young life and when I was raising kids, and my kids are my practice for a long time. But recently, I would say I have decided in my 60s that I need to front load my day with what's important. So I get up usually before 5:30, and I wash my face and brush my teeth and scrape my tongue. Got to do that. Drink some lemon water, and I go sit. I just sit first thing. My body's comfortable enough that I can do that. If my body wasn't comfortable, I would stretch first thing, but I go and I sit. And that means prayers, that means meditation practice, it means some pranayama practice. And those things are pretty stable for me for years now. And then after that is when I do something that's physical. I usually walk or jog, and then I come back and I stretch and I shower. Or I might jog and shower and then stretch, depending on the order of those things. But because that's important, especially as my body's aging, I need to keep it limber And I pay if I don't. I mean, I was traveling last week and I didn't do asana for like 3 days and my back hurt. Not hurts, but like it's stiff. It's not comfortable. You probably feel the same way, but back when I first started doing yoga, when I was in my 30s, it was like, this does nothing. It's nice and it's loose and it's fine, but it didn't really do anything for me. I wanted to do more challenging poses, But now the simple things, the limb brain's great, just what my body needs. And then, apart from that morning kind of routine thing, I really try to keep studying. The other part of my practice is to be curious about my own evolution. And so I'm reading the sutra, or I'm memorizing prayers. Right now, Panditji's all about the prayer called the Sri Sukta. And he's been teaching this for years now. Memorizing that or other prayers of this tradition is good for my brain. It feels like I'm helping my brain stay sharp to memorize things. Yeah, and it helps us be a more engaging teacher. The more we evolve, we're never done. We're never done. It's not like we don't ever reach the finish line. It's like we're constantly evolving and growing and having new insights. Then we share those with the people that come to us. So I'm sure I do medicine in a different way now than I did 30 years ago. I'm trusting that's for the better. I feel like my practice has given me more intuition and then I trust it more than I used to. Yeah, it's really, it's lovely. Like you begin to trust that your practice is supporting you. Like it's like you're in the river of it and it's guiding you somewhere as opposed to you having to like manage it. It becomes the support that's guiding you.
Mm-hmm. So true.
Mm-hmm. Pretty awesome.
Mm-hmm. And
I
so
feel lucky.
Beautiful. Yeah.
Yeah, it is.
Yeah. And I hear that in your share and just really appreciate you taking the time to be here and sharing that with me and all the listeners here. It's been a real delight to meet you.
Well, thank you. Thank you for inviting me. It's been a delight to talk with you. I appreciate all that you do in the world and how you inspire and lead your students.
Thanks again for listening. If you're interested to learn more about who we are and what we do, check us out at innerpeaceyogatherapy.com.